Hello, good day. My name is Dr. Tride Ufondu of Snowspirations Global Health Solutions. Today is the 18th day of March 2023 and is our normal clinic on weekend. Open clinic with Dr. Tride. And today we're going to look at the stepwise management of unexplained infertility. So, what's unexplained infertility? How do we diagnose unexplained infertility? How can we manage unexplained infertility so you can start your family? So when you join, please let me know who you are. I'm going to spend probably about 30 minutes. So the first part of my presentation, I'm going to take you through what unexplained infertility is. Then I'm going to give you stepwise guidelines on what you can do to achieve success if you have a diagnosis of unexplained infertility. So once you join, please let me know your name, let me know where you're located, and I'm going to start as soon as possible because we have a lot of things to talk about. It's possible the reason why you don't have your babies today is because of unexplained infertility. And it's important you pay attention to this presentation. Invite your partners, invite your male partners, invite your friends, invite your brothers, your sisters, anybody that lately got a diagnosis of unexplained infertility will benefit from my presentation. So I'm going to start. When you have unexplained infertility, it means we have checked the female reproductive system, we have checked the male reproductive system, and we could not find anything that might be leading to your inability to conceive and have a baby. So unexplained infertility is a diagnosis of exclusion. So we would have checked the whole female reproductive system, starting from the vagina, the cervix, the womb, the tubes, the ovaries, and at the end of our assessment, we can pinpoint if the problem is coming from the vagina. We can pinpoint if the problem is coming from the cervix. We can pinpoint if the problem is coming from the ovaries, the womb, the tubes. The hormones are okay. Everything is okay with the woman. Everything is okay with the man. But pregnancy is not happening. It's only at this stage when we must have ruled out other possibilities that we can arrive at unexplained infertility. So it's a term that most health providers will use to describe infertility after all fertility tests reveal no obvious cause of infertility. How do we diagnose this? Would have checked the woman, would have checked the man, and after we are done with fertility evaluation, then we are now going to come up with possibility that you might have unexplained infertility. I'm going to give you the criteria. I'm going to give you the test we must run. We must rule out any problems with the uterine wall. So when we rule out any problems with the uterine wall, we won't find any fibroids, no scar tissues, no adhesions, no polyps, no structural problems. We would have ruled out the fact that you're ovulating. So you have eggs. The eggs are functioning, you have signs of ovulation, and you're ovulating regularly, your cycle is regular. We would have checked your tubes, and we see that your tubes are open, no obstruction, no blockage, no hydrosalpinx. We would have made sure we've checked your ovarian reserve. So we would have checked your anti-Mullerian hormone. We would have checked the brain production of all the important hormones. So your estrogen is good, your FSH is good, your LH is good, your prolactin is good, your progesterone is good. Then we would have also checked your partner's seminal fluid analysis. Good count, good morphology, good motility, everything is good to go. When we have checked all this, and I wanted to focus on 35. So if you are 35 years and above, and we have checked all this paraphernalia, and after 6 months of regular unprotected sexual intercourse, pregnancy is still not happening, then we can give you the diagnosis of unexplained infertility. If you are below 35, if you have done the basic things you're supposed to do for 12 months and still no pregnancy, and we have checked and everything is intact, then we can give you a diagnosis of unexplained infertility. Now, the hallmark of managing your unexplained infertility is stepwise approach. Now, the bigger question is it possible to get pregnant if you have unexplained infertility? The answer is yes. So despite the fact that all this while you've been trying for the past 6 months, you've been trying for the past 12 months, you are not pregnant, pregnancy can happen spontaneously. There is a particular study conducted in America, National Institute of Health, and they found out 92% of couples with unexplained infertility who had fertility treatment ultimately had children. So you need help. At this stage, you need to retain the services of a fertility specialist. What are the likely things that can cause unexplained infertility? Now, it's kind of ironical and it's more like an oxymoron to talk about unexplained infertility and you're trying to explain it. But in some situations, majority of the times we don't know. But there are some factors that might likely be the reason why you might have the so-called unexplained infertility. So you might have undiagnosed underlying condition that the test could not pick up. So we are not completely sure. So some people can have uncontrolled diabetes. Some people can have thyroid problems. Some people can have celiac disease. Some people can have endometriosis. Some people can have problems with the cervical mucus. And some people, it might be the air quality. It might be the sperm quality. It might be the cover of your womb. It might be the fact that you're not making love the right way. You're timing your love making. You're doing the so-called ovulation love making. So these are the factors that might play a role in the possibility of having unexplained infertility. Sometimes there is no cause. We try everything. There is no need to start freaking out. We need to achieve pregnancy, and there are so many ways we can do this. Thankfully, there are things we can do from reproductive perspective. Now, I've already mentioned how you can diagnose this. So we need to run some tests. We need to have a complete medical examination. We need to examine your sexual history. We need to have a physical examination. We need to take your blood, look at the hormones. We need to look at your reproductive organs, your ovaries, your tubes, your womb. We need to run an ultrasound. We need to do laparoscopy. We need to do hysteroscopy. Everything we need to do that. We need to do your seminal fluid analysis. We need to do your ovarian reserve test. And we need to confirm your ovulation. When we have done all this, and everything is looking good, and you're still not pregnant, it's at that point we will diagnose you of having unexplained infertility. If the fertility specialist you're using, an obstetrician, performs comprehensive testing and still can't find the cause, you have a classical unexplained infertility. Now, let's talk about the management, which is very, very important. What are the likely management of unexplained infertility? Now, because we can't find the cause, we will definitely recommend stepwise approach in regards to management. There are some factors we need to bring in: your age, your immediate circumstances, possibility of pregnancy in the past. But the popular common treatment for unexplained infertility, number one, assisted reproductive technique, ART. I know so many women, especially back home in Nigeria, are not comfortable anytime we talk about ART. An example of ART is your IVF and your IUI. So ART is a type of fertility treatment that involves fertilization happening in the lab. So we're going to take over the process of trying to fertilize by doing it in the lab. So if we are using IUI, IUI stands for intrauterine insemination, and we also have in vitro fertilization. If we are using IUI, we are going to collect the sperm, we concentrate the sperm in the lab, then before we inject it into the womb, making sure that you're ovulating, hoping that when we inject it into the womb, the sperm will find their way to the tubes. If we are using IVF, it means creating embryo in the lab. How do we create embryo? By uniting the egg and the sperm to form embryo. We can also use donor sperm. We can also use donor eggs. Then afterwards, when we form the embryo, we move it back into the womb. Some women and some men can also go for ICSI, a superior type of IVF, intracytoplasmic sperm injection. We inject the sperm directly into the eggs. ICSI is a more superior IVF that will subsequently help you to become pregnant. Now, some people will be given medications. So there are some women who need to give ovulation induction drug. The commonest ovulation induction drug is your Clomid. Clomid is a type of hormone a type of drug we call gonadotropins. So when we give you Clomid, it will go to your ovaries and challenge your ovaries to produce eggs. Some providers will also give you some off-label letrozole, which we call Famara, and it will also act to promote egg production. Remember, you have the eggs already, but we simply need to make sure that the eggs are healthy and ripe so we can use them. Now, it's also important that lifestyle modification is also elaborated. So you need to enhance and change a couple of poor lifestyles you're probably adopting. Several lifestyle factors can contribute to infertility. So you need to avoid smoking, drinking alcohol, using recreational drugs. Make sure your body weight is within normal range. Eat well-balanced diet. Try at least 30 minutes of physical activity. Limit your caffeine consumption. Reduce your stress. Sleep. When you do all this, ultimately, as a final approach, stop timed ovulation or fertility window lovemaking. Improve your timing of lovemaking. Make love regularly, every other day. There is a tiny window of time you can become pregnant, which is actually 24 hours. So the more you engage in lovemaking, the more you're depositing the sperm, the more the possibility of pregnancy happening is very high. So unexplained infertility can also respond to regular lovemaking because your chances of becoming pregnant will be maximized when you have availability of sperm inside the vagina. Now, it's always good to get second opinion and be aggressive with your fertility treatment if you have unexplained infertility. But this, in a nutshell, is the stepwise approach in managing your unexplained infertility. Please, the floor is going to open now. Start asking your questions. Feel free and ask your questions. Join me to our Facebook page. Immediately after this, I'm going to repeat this clinic in our Facebook page. So if you're not in YouTube, but you're in Facebook, make sure you join me immediately after this. Remember to register for the event coming up next weekend, Gender Selection and Prevention of Sickle Cell Disease in the Family Masterclass. Please start asking your questions quickly. We have about 3 minutes to get this done. Ask your questions, please. If you have any questions, feel free to ask. I'll give you feedbacks. Thank you, George Abe from Ghana. Thank you, Chinyere, our moderator. Please ask your questions. If you don't have any, please indicate so I can transition. Feel free and ask your questions. I'll provide you feedbacks, questions on unexplained infertility. Very important topic. So many women might be going through this. So many men might be going through this. It's about time you do the right thing so you can start your family. So I have 2 more minutes. If I don't have any questions within the next 2 minutes, I will adjourn the clinic and I will see you guys again on Tuesday. Ask your questions. Any questions, any health-related question, fertility-related question, concerns, worries, this is your opportunity in the next 1 minute. No, ART is not the only option. Remember, I mentioned avoiding timed intercourse. Make love regularly. Watch your lifestyle. So all the lifestyle modifications, ART is indicated if all these little modification fails. So you don't just jump into ART. You don't just jump into IVF. IVF is always the last option. So when you modify your lifestyle, when you keep making love regularly, when you go for your checks, when we check your hormones, when we give you medications, and if it fails, then we graduate to IUI and IVF. So it's not the only option. I've already mentioned the stepwise approach. Okay, do we have any other question? The key word is to have a fertility specialist that will take time and go for aggressive management. You have to be very aggressive in dealing with infertility. That's the only way you will defeat infertility, because infertility is aggressive. So you have to meet infertility halfway. You cannot be passive with infertility and you succeed. No. The aim of infertility is to stop you from being happy. So you need to be ready, you need to be aggressive, you need to be meticulous, you need to be proactive in defeating infertility. Okay, so that's the last question I have. Thank you so much for coming. Please quickly hop into our Facebook page and we continue the conversation there. Until I see you, thank you so much for coming, and bye-bye for now.